So we want to stay on this story and bring in Dr. Susie Hoda. She is the Medical Director for Infection Prevention and Control at the University Health Network in Toronto. Thank you for joining us, Dr. Hoda.
Oh, it's my pleasure.
Okay, so since you're in Ontario, why don't we start in this province, and it's lifting capacity limits, as we just heard from Laura. Is this the right move at this time?
You know, we never will know entirely when it's the right move. And I think at some point we just have to make a decision and be able to live with the possibility that there's a risk that cases could go up and be prepared to course correct if that's the case. So, you know, the good news is we've got fairly high vaccine coverage within the province in terms of first doses being around 88% and second doses around 84%. That sounds good. You know, is there a magical time when this would feel more comfortable for everybody? It's hard to say. But again, we just have to have a plan to be continuously monitoring how it's going as we start to reopen and do it gradually.
And, you know, the sort of back and forth when it comes to reassessing based on how the numbers are going. I'm wondering here if people should be prepared for case counts to go up as soon as we make this move, but perhaps not to panic or to reassess.
Well, I think there's some possibility that overall case counts might go up a little bit. I think in this first stage of reopening, it's less likely that we're going to see a big bump in cases. But as we kind of move forward and advance in that process of reopening, I think that's where we may see as we take down capacity limits across the board. What worries me a little bit is a vaccine certification program coming down, because that provides people with some security. It does control the situation a little bit more. So I would have liked to see that stay on for as long as possible, to be honest. And, you know, I should make a caveat in terms of the vaccine coverage that I referred to. That doesn't include all Ontarians. And so, you know, if we're able to wait until 5 to 11-year-olds at least to get vaccinated, which is coming up, hopefully in the near future, that would put us in a better position in terms of the overall population being covered with vaccines and making it safer to move forward on the different steps. So, you know, these are the things that we have to be kind of watching for and implementing at the same time to make it the safest process possible.
You know, you referenced that Ontario announcement in regards to lifting proof of vaccination requirements and sort of a timeline that has been set for that. Do you think that that sort of an approach is the right way to go, given the fact that, as you mentioned, the vaccine for age 5 to 11 is yet to be approved and rolled out if approved? And also we've got the holidays, the December holidays coming up. So last year, I believe we did see a spike following that. How much of that should be taken into consideration aside from giving that date that was thrown out there? Or I should say announced.
Yes. Yeah. The holiday season is a very important event, I think, because that's a time when people can travel. It's a time when people will be gathering and amongst different households. And it's a time where I think we kind of lose a little bit of sight of what's happening. People are on holiday hours, et cetera. There is a little bit of a lag between when the holidays typically end for people and when the next stage will occur in the reopening plan. But, you know, I think that that's a period when we're going to have to be prepared to possibly see an extension in monitoring things. It's likely that cases would go up just independent of the reopening plan, but just because of behaviors and social contacts and things like that. And also, let's keep in mind, this is a time of year when other respiratory viruses go around and all that. So, you know, I think that we have to be mindful of what those impacts are on, you know, hospitalizations. And we just don't know what to expect from that. So that's another thing we have to keep an eye on, because if the healthcare system shows signs of being overwhelmed, we've got to consider all the tactics that we have to try and control things.
So I'm wondering now what your thoughts are on the approach that British Columbia is taking, because we know that they're also lifting capacity limits, but it is dependent on vaccination rates. So it will be lifted where there are higher vaccination rates, and the capacity limits will remain where the vaccination rates are lower.
Yes, I mean, that seems like a more nuanced approach, and, you know, to try and encourage people to get vaccinated in the lower vaccination areas. But I guess what's difficult is people can easily travel if they can't get, you know, a reservation in their local area because the capacity is reduced. They can travel to an area where there is a higher capacity, you know, so it doesn't change that aspect of it. So I guess it'll remains to be seen how well that would work.
All right. Well, we appreciate your time and insight today, Dr. Hoda.
You're welcome.
That is Dr. Susie Hoda, and she is the Medical Director for Infection Prevention and Control at University Health Network in Toronto.